ventricles of the heart to depolarize and repolarize, or contract and relax. Because this interval varies with heart rate, we often account for this variability by calculating a corrected QT interval, or QTC for short. Normally, the QTC is less than 440 milliseconds in males and less than 460 in females. Any longer is considered prolonged, with QTC intervals greater than 500 milliseconds putting people at risk for arrhythmias like torsades. This prolongation can occur for a multitude of reasons, including congenital cardiac syndromes, electrolyte disorders, and even being caused by certain types of medications, leading to a drug-induced long QT interval. There are many medications that can cause this, so here is a quick trick to help you remember the classes of medications which put people at risk. Just remember the ABCs of drug-induced QT prolongation, or more specifically, the ABCDEs. That's A for antiarrhythmics, B for antibiotics, C for antipsychotics, D for antidepressants, and E for antiemetics. Although this list doesn't cover every single medication that can cause a prolonged QT interval, it's a nice way to start to organize the many medications that can cause a prolongation of a person's QT interval. More importantly, I found this mnemonic covers most of the medication classes that are most likely to be tested on your clinical exams.
The QT interval represents a single ventricular cycle of contraction and relaxation. The Q of the QRS complex represents the beginning of ventricular activation and contraction, and the T wave represents ventricular relaxation and repolarization. Together, the QT interval describes the time that this entire process takes. Now, speaking of time, what are the acceptable intervals for this measure? Well, broadly speaking, the QT interval should be less than half of the R to R interval, and more specifically, the QTI should be less than 0.44 seconds in men and less than 0.46 seconds in women. We can see this here. Women are known to have longer QT intervals when corrected for rate as compared to their male counterparts, but the mechanism is not fully understood. Fortunately, though, it's not an absolute predictor for cardiac arrhythmias. Long QT syndrome, which we see here, may be hereditary, electrolyte-induced, or drug-induced. In fact, medications with antiarrhythmic properties like Sotalol, flecainide, amiodarone, and some others have the potential to prolong this interval. Patients that are undergoing loading therapies for these drug types often have their QT intervals measured using serial ECGs. And if you notice that the QT interval is approaching or exceeding 0.5 seconds or 500 milliseconds, you should notify the provider. If it's left untreated, long QT syndrome predisposes people to a potentially lethal form of ventricular tachycardia known as torsade de poids, which translates to a twisting of the points, which we can see here. It's also said to represent a party streamer of sorts. So if a PVC or another early beat were to strike the T wave while the ventricles were refractory and repolarized, and repolarizing, the heart can be thrown into this electrically chaotic state where cardiac output has the potential to fall dramatically. And remember, the major reason why we care about any of these cardiac arrhythmias is the effect that they have on total cardiac output. So be on the lookout for the medications that you see listed here. They're commonly known to prolong the QT interval, but just be aware that it's not a conclusive list. So take-home points related to the QT interval are that it represents a single ventricular cycle of contraction and relaxation. Number 2, the QT interval should be less than half the R to R interval, generally speaking, but more specifically, it should be less than 0.44 seconds in men and less than 0.46 seconds in women. Number 3, long QT syndrome predisposes patients to a potentially lethal form of ventricular tachycardia known as torsade de pois. And finally, long QT syndrome may be hereditary, may be electrolyte induced, or it can be drug induced.